The idea behind the Nutrition Convergence Centre was basically to see how can we ensure that the different services around agriculture, social protection, water and environment, and health come together so that we could address the many underlying factors of malnutrition at the same time, because that is the only way evidence has demonstrated that you can reduce stunting by bringing together or by bringing the different components of nutrition specific and nutrition sensitive into the same household. We expect there and then to get greater impact in improving the nutrition status of young children. Mumbwa was picked in particular because of one, it is one of the districts that is already implementing scaling up nutrition program, and also we had some initial activities. Mumbwa was part of was part of the SUN 1 scaling up nutrition phase 1, and one of the things that the funders also looked at was to look at districts that are already have structures, multi-sectoral structures that are managing nutrition program in the district. The resources mainly were used first of all to establish the Nutrition Convergence Centre. At the Convergence Centre we had to put in temporary structures. For example, the structures which housed the chicken, we had a chicken run, constructed the fish pond, constructed the water reticulation, put up a training shelter. We had to put up also the orchard. We had to put up also the shelter for processing equipment, for dehallers, the peanut making machines. We also had the solar installations that we had, for example, for water reticulation system. So that's one component. The other component, of course, was now community level activities, training volunteers. We also had to invest in procuring inputs like for iron-rich beans, the orange maize, orange flesh sweet potatoes. All these were inputs that were provided. For small livestock, we managed to buy chickens for the households as well as for the center, as well as buying fish fingerlings for the fish pond and even the feed. So those are the main costs that the budget went to. But of course, with some costs going to administrative part in terms of fuel, allowances for field worker staff, as well as for monitoring and also community sensitization. With this project, the Food and Nutrition Commission was the main partner, and which had to take the overall coordination of the program. And then we brought in a PAM, Program Against Malnutrition, specifically to address the community level actions. How can they be, enhanced in a converged manner? And then we had Mumbwa Nutrition Group, where we assigned them specifically to be able to, particularly when we looked at the aspect of sustainability, we expect that the Mumbwa Nutrition Group will continue with the community level activities. And then the District Nutrition Coordinating Committee for Mumbwa was charged with the overall management of the project at the district level. And at sub-district level, we had the Ward Nutrition Coordinating Committee. These were working now together with the Mumbwa Nutrition Group to see that convergence takes place at the community level and household level.
PAM was involved, I think, even from before the program started, in the conceptualizing of the project itself, together with National Food and Nutrition Commission, bringing all the details that had been from the evaluation of the MCDP2, that we needed to bring these interventions that fight malnutrition in one center. And that is why the Mumbwa Nutrition Centre is called Nutrition Convergence Centre. And it is a pilot project. It is the only project that brings all interventions of water, agriculture, nutrition, and hygiene so that these are not implemented in isolation, but they are converged in one place. I'll start with the National Food and Nutrition Commission. Their role was to take lead and direct how this program was to be implemented, and they also acted as a link with the United Nations Office for Project Services, UNOPS, to secure the funds. And they've also ensured that through the district nutrition coordinating committees, as well as the local authorities, such as the district administration, are involved, and also the traditional leaders. Whereas PAM was involved in the mobilization and identification of the mother groups who are the participants. In fact, for Mumbwa itself, we were able to identify 900 households. So, and when you go to the district administration has taken ownership of this project because this program remained within the districts for sustainability. And they took up a leadership role to supervise the Mumbwa Nutrition Group, as well as the district nutrition coordinating committees and the ward nutrition coordinating committees, so that the communities on this project.
Our role is to, like I said, to monitor, as well as to plan and offer guidance to all the relevant players that we have here in the ward, starting from the zones that we have in the wards, and working hand in hand with the community-based volunteers that we have dotted all around the ward. Nambala ward is a ward that has well over 2,000 households, and these households are found in a total of 42 villages, and these are villages that are led by the head persons, I would say, and within that we have zoned it into the ward into 7 working zones.
The community was involved right from the word go. The land at which the center was to be established needed to come from the community. And the community worked together with the traditional leaders there to give us a piece of land, which will still remain with the community where the center was to be involved. Then we have the district administration that was also involved in supporting the district nutrition coordinating committee to ensure that they take ownership, as well as ward nutrition coordinating committees. They are also involved in the construction of the structures. They had to provide local materials. They had to contribute their labor. They also had to contribute their time during the construction of the center. So even clearing of the land at which the center was to be put, the community was involved. So their involvement is immense to this project. Some of the members of these communities are involved in the cultivation of the land at which crops are to be planted, as well as getting involved in the planting itself of various crops, legumes, vegetables, fruits. They are involved. And also when we were setting up the fish ponds, the community needed to be involved to contribute things like sand for the construction of the chicken houses, and also for the construction of the water stand. The community needed to be involved. Even caring, management of the center itself, the community is involved. So there are various activities for them to learn from, and even when they move away from the center, they are learning something which they replicate in their communities.
Under this project, there are some beneficiaries that are there. These beneficiaries, they are the targeted people first in the first, and just say rank to say so, are the Cbvs, community-based volunteers. These people, they were brought to us by the project coordinators, and they are from different ministries. Some they are from health department, some they are from agriculture, some they are from livestock department. So they were brought together by this project in order for them to help us spread this message out there to the people that are living in their neighborhood. So as a department, we trained about 30 people in fish production. That was in fish production, fish pond management, then there was also fish disease management and also feed formulation.
So the center, the purpose was to bring that the community volunteers would bring different women from their catchment areas to the center to learn, the need to do a number of interventions if they have to address the problem of malnutrition. They would look at how do they do fish farming, how do they properly raise their chickens or small livestock, how do they, why should they grow things like fruits at their household, how should they grow vegetables, and also learning how to process and preserve the produce that they have. So really the center was intended to be a place where the households and volunteers can exchange knowledge. So it was a knowledge transfer base. And from the center, the community volunteers now used to conduct follow-up sessions in the villages, following up households, to reinforce what has been learned from the Convergence Center.
We have specific and sensitive nutrition activity that we do take. So let's say we take the sensitive nutrition activities that stands much on the prevention of malnutrition. So we prevent children from suffering from malnutrition. So you'd find that we sensitize our clubs. Then with the clubs, we go down to the communities with the help of headmen and other influential traditional leaders and men in the communities, men and women in the communities. As you are much aware that malnutrition cannot be fought only by women alone. We have to fight it together, men and women.
Bukale mbutu wa ukaraga utanagiza nutrition club yeji. Twaka kukara ucha mapenji kambo. Kanji bana kabayanika kusata burwaji bwanzara. So ni kwakeza kakabunga ka nutrition club twakaya kwiya mbuba sani na bana mwana chindina jarwa kushika 6 months amana ukuvwa 6 months kuya kushika 2 years byonse twakaiya. So nitwakeza kono twakatalika kuyisha benji nokwesa. So kuvwalya nitwakaiya bolya bubo tumutu akabonamo twakaona kwamba ati malnutrition akeza kujokanshi kunshi koku kakulichi malnutrition kubana maningi.
I was very happy because now one the people will learn how to do what type of food they should be growing, how to grow it, how to prepare it, how to feed their children, and so on, and themselves. They are going to learn how to keep even rare birds, I know. Like chickens will be reared. They will know how to rear different types of birds and how to market them. They should be using the money and so on. So that is very, very encouraging because they are going to learn all these things from that center.
So, Burigo guno amu village omna go guno kona go chifidomu kamono. Twakaba tamburaga batwa group ya nutrition. Turigonde dwe maningi. Kwamba bagatuletera afesti twagahora bagareta binizi twagashanga then ari bagatuletera mitenga ya gandoro. So turarumba maningi kambo bana twarigura binizi. Twabona otuya tu binizi twagupima twapusana ayaguririmina kambo bana turabasanina gabotu mburi bwerede kandoro yagupya rimwe turahuriya gabotu na wabura maria agura bread mu shop bana nko guti guseni breakfast nga bararigwa shambona.
Because the way the project was designed was that, for instance, at PAM, we trained the beneficiaries there in chicken or livestock management, also in crop management or agriculture, also hygiene and sanitation. And they also took ownership because, for instance, with 900 chickens were distributed to the mother groups in that area, and 100 chickens were retained at the center for demonstration. And whatever happened at the center was also replicated in the 30 mother groups that we worked with. So the fact that they took up this knowledge and they've been part of this program from the word go, and the interventions that have been implemented at the center, such as fish ponds, from which they'll be able to raise their own, from fingerlings to table-sized fish, which they can also sell to support the center. And then they can also replicate these fish ponds because they are made using mostly local materials. So the crops, the diversified crops that were introduced and how to manage them. They can also sell some while they use some as a source of nutrients for their households. So you find that this project is all comprehensive, and it's a multi-sectorial approach with other ministries also help to sustain this program.
It's quite interesting, and I'm seeing positive issues on a condition that us as DNCC, we look at sustainability. The moment the funder moves out, the moment it stands on its own, how is it going to be sustained? And this is what we are trying to look at. That's why we're involving the local people. That's why we're involving the Mumbwa Nutrition Group. Because these people, the Mumbwa Nutrition Group, have been doing that. They have groups there already in the community. So as we come on, we are just trying to supplement what they are doing.
The Mumbwa Nutrition Convergence project has actually answered to what we had envisioned, that it's possible sectors can converge at household level. And that's what has really given us hope that with this approach we can roll out for greater impact of reducing malnutrition in the country.
Yes, convergence at family level is really being accepted because we're looking at this target that we look at under the 1,000 most critical days program, because under the 1,000 most critical days program, we look at this pregnant mother, we look at this child who is under age of 2. So those with the information that they are receiving and the practices, because you find that it's a package that goes to this household. It has to be a package in that there should be a component of wash in there. There should be a component of food production, productivity and utilization. There should be a component of health, seeking behaviors, hygiene. So all those parameters, we deliver them as a package to a household. So they are quite receptive and responding. And those now, they are also able to share that information with others in the community.
The project actually performed to our satisfaction. First was to prove that it's possible convergence can happen at household level. And secondly, is that it's possible the different sectors can come together to deliver the service. However, we had actually a number of challenges which actually derailed the implementation, particularly the COVID-19, where we had to suspend some of the activities, such as, putting up the structures. And that was because of the restrictions in movement. So that costed us time. But however, we are glad that at least knowledge transfer took place and that convergence is possible. The National Food and Nutrition Commission intends to use the lessons from Mumbwa Nutrition Convergence project to roll out to other scaling up nutrition districts, first of all. And also even within Mumbwa, it has to be rolled out with the District Nutrition Coordinating Committee working with other partners. So our plan as NFNC is to ensure that we roll out this scaling up nutrition innovation in all these districts. There are about 42 districts now that are implementing scaling up nutrition.
Of a nation is, it's the engine of a healthy land. Good nutrition is the heart of a nation is, it's the engine of a healthy land. Good ya queen, nikungala queen. Good ya queen, nikusunga well. Na tubombele chapa mo. Time to take action.